Welcome to the Joint Legislative Oversight and Sunset Committee meeting. My name is Kyle Evans-Gay. I represent the 5th Senate District, and I'm chair of the Sunset Committee this year. As we do each time, I'd like to ask our members to introduce themselves, starting with our Vice Chair, Representative Dorsey Walker.
Good afternoon, everyone. Representative Sherry Dorsey Walker of the 3rd District, and I represent the west side of Wilmington.
Thank you, Representative. Senator Pettyjohn.
Thank you, Madam Chair. Senator Brian Pettyjohn, 19th Senate District in Sussex County, representing Bridgeville, Georgetown, Longneck, Harbison, and lots of places in between.
Thank you, Senator. Representative Johnson.
Thank you, Madam Chair. Good afternoon, everyone. Representative Kendra Johnson. I represent the 5th District here in Castle County, a little bit of Newark, Newcastle, and Bear. Thank you so much.
Looking to a 5th District competition at some point in the future, Representative Johnson. Representative Griffith.
Good afternoon, Madam Chair and committee members. I'm Krista Griffith and I represent the 12th District.
Thank you, Representative. Representative Spiegelman.
Thank you, Madam Chair. I'm Representative Jeff Spiegelman of the 11th District, the only representative district too good for one county.
Thank you, Representative. Senator Richardson, please.
Hi, Senator Richardson. I represent the 21st District from Seaford to Delmore.
Thank you, Senator. Representative Yerrick.
Good afternoon, State Representative Lyndon Yerrick for the 34th Representative District.
Thank you, Representative. Senator Pinckney, are you able to introduce yourself?
Absolutely. Thank you, Madam Chair. My name is Senator Marie Pinckney, representing the 13th District, parts of Newark, Newcastle, and Bear that I do share with Representative Johnson. So when you guys have that 5th District battle, I'm going to bet on Representative Johnson.
Oh, I'm already coming from behind now. Okay, harsh truth. Senator Hansen, please.
Thank you, Madam Chair. Stephanie Hansen, Senate District number 10.
Thank you, Senator. And I would ask our staff for our guests to introduce yourselves, please. Can we start with Mark, please?
Thank you, Senator. My name is Mark Brainerd Jr. I am one of the 2 analysts for the Joint Legislative Oversight and Sunset Committee.
Hi, good afternoon. I'm Amanda McAtee. I am the other analyst for the committee.
Thank you both. I can't hear you, Holly. That's okay. I'm happy to introduce Holly Vaughn Wagner, she's with the Division of Research and serves as the attorney for the Joint Legislative Oversight and Sunset Committee. I hope I did that well, but you justice there. And Ms. White.
White, I'm the administrative support staff for the committee.
Thank you.
Hello, everyone. My name is Elliot Gray, and I'm the legislative fellow for the committee.
Thank you all. Thank you to our committee members and to our staff and to everyone who has joined us today for the presentation that we have ahead of us and for the review of recommendations following up from last week's meeting. Because we are moving ahead and following, as we talked about in previous meetings, we're following up with work that was done last year. Again, we are facing today a sort of hybrid meeting. And so I wanted to provide some clarification for the committee and for those watching as well. So we're first going to have the presentation and welcome to 2 guests from Delaware Nursing Home Resident Quality Assurance Commission. And I don't know how you like to pronounce your acronym, but the DNHRQAC will present information and the committee members are going to make comments and ask questions. We'll also have a public comment period as we have had in the past for presentations. So we'll follow much like we did last week. After that, we're going to move and look at the draft recommendations for the Delaware Interscholastic Athletic Association, and our staff is going to present the draft recommendations for the committee's discussion. Staff from DIAA will join us at that time, and they'll be available to answer any questions that members may have. And remember that even though there is no public comment period specifically for the review of draft recommendations, the public continues to be welcome to submit comments to the sunset@delaware.gov email address. This issue came up this past week as we received information from members of the public. And we want to remind folks that if there is a wish to remain anonymous in your comments, it's possible. You just need to indicate so in the text of your email, and the committee will maintain that confidentiality. I should say the staff will maintain that confidentiality. Another option you have is to email Holly Von Wagner directly, and she can also work with the staff to make sure that your comments are submitted to the committee. So remember, in either instance, all of the identifying information is going to be redacted. And that should hopefully provide folks comfort, as well as open up opportunities for productive conversation from the public on some of the topics that we are addressing as a committee. The first thing I'd like to do before we move into the presentation, however, is to take a look at the minutes from last week. We met on February 10th, 2021, and the draft minutes were circulated, and now they're available here on the screen. And if the committee members have had an opportunity to review the draft minutes, I would entertain a motion at any time.
So moved. Senator Richardson.
Second.
Thank you, Senator. I'm sorry, who was the second?
Representative Dorsey Walker.
Thank you. I thought so. There's been a motion and a second. Any comments? All right. All those in favor, please signify with your silence. If you oppose, please unmute and say nay. All right, thank you. The motion passes. All right, I'm now glad to move into the presentation portion of the meeting. I'm happy to welcome representatives from the Delaware Nursing Home Resident Quality Assurance Commission. To present today, we have Margaret Bailey, the Executive Director, and Lisa Ferber, Chair of the Commission. So Ms. Bailey and Ms. Ferber, I'll hand it over to you to begin your presentation, and please introduce yourselves in the beginning to the committee and members of the public in attendance.
Sure. Hi, thank you.
Oh, we're getting some feedback.
Is this a little better?
It's not, unfortunately.
I think it's because what are Lisa and Margaret in the same room?
Right.
Yeah, you're going to get that unless somebody puts headsets on or something like that.
Lisa, do you want to turn it on?
I can turn mine off and we'll just, would that be okay if we just move the screen back and forth?
If you're comfortable with it, that works for us.
Okay.
Whatever your comfort is with. Okay. I want you to be able to stay safe as well. So whatever is best for you. Ms. Bailey, did you mean to unmute?
Hi, everyone from the Joint Legislative Oversight and Sunset Committee and members of the public. My name is Margaret Bailey, and with me today is Lisa Ferber.
Hi, everybody.
We want to thank you for providing us an opportunity to showcase the Delaware Nursing Home Residents Quality Assurance Commission. I would like to mention that several commission members and interested parties have joined us today as well.
And
thank you. And you're free to introduce them as well.
You can hear me?
Yes, I'm so sorry. Please continue.
No problem. As Margaret mentioned, and thank you very much for the introduction, my name is Lisa Ferber. I am the current chair of the commission, and I'm going to share a little bit of the history of the commission with you. In the late 1990s, former State Senator Robert Marshall, he had a real interest in nursing home reform, and he created a state legislative and citizens panel on nursing home reform. And that panel there was a press conference that was held in September of 1997 at the Claymore Senior Center. And Senator Marshall at that time announced this formation of a panel due to overwhelming number of citizen complaints about nursing home care.
The panel met 3 times. They were to hold 3 public hearings, and because there was such an outpouring of interest and public comment, they actually added a 4th hearing and took public comment about nursing home care and the quality of care in the state of Delaware. And during the public hearings, many Delawareans, they provided testimony. There were over 300 individuals that contacted that panel at that time. 62 witnesses testified during the hearings, and 35 individuals submitted written testimony. 6 people testified before the panel in an executive session. And then after the public comment period, the panel held a public review of the state agencies at that time. Agencies were invited to make presentations concerning their responsibilities for nursing home oversight and regulation. They were asked to provide recommendations for improving their ability to protect the residents from abuse, neglect, and financial exploitation. 5 witnesses testified, including representatives of all 51 nursing homes. Public hearings for the nursing home industry representatives were also held. They addressed the panel concerning nursing home care. They presented recommendations as to the current regulatory system and how it should be changed to ensure the residents were receiving quality care and service. There was also a roundtable workshop that was held at that time. 40 persons, including policymakers from the governor's office, the Department of Justice, the Delaware Department of Health and Social Services, the state auditor's office, nursing home industry representatives, and panel members participated in some day-long discussions. There were a series of recommendations that were made as a result of the roundtable workshops. They included creation of the Division of Long-Term Care, as it was called at that time, the Office of Long-Term Care Ombudsman, an appeals process and advisory boards, nursing home employee training and development, a code of ethics and public disclosure, nursing home economic issues and interests, and quality of care issues were all part of the recommendations.
So I'd like to give you an idea of who we are. I've been with the commission since 2007. I've been the only staff with the commission, and currently Lisa's our 3rd chair. We have other individuals that are serving, such as Lieutenant Governor, some representatives, Representative Kim Williams. We have faculty from the University of Delaware School of Nursing, Lorraine Phillips. Hu Shang is the state pharmacy director. We have Kyle Hodges, who's with the disability community. Karen Gallagher, who had been a resident of a long-term care facility and lives in the community now. Amy Milligan, she's over at the Life Center St. Francis. Dr. Cofrero is a psychologist. We have Norma Jones, who is a resident of a long-term care facility currently. Christina Contes, who's with the Medicaid Fraud Control Unit, and Cheryl Hikes, who's with the nursing home industry. The commission's currently comprised of 13 members and staffed by 1 individual. Membership includes the healthcare professionals, law enforcement protection agencies, the industry, and advocates. We have representation throughout the state. And as of January, we do have 1 membership vacancy. We've been in touch with the governor's office regarding the vacancy and hope to get it filled soon. Some of the memberships are appointed by the governor's office, and others are appointed by the Speaker of the House or Senate pro tempore. The remainder of members who are appointed serve as a designee of a particular organization. Here's where we're located within the Delaware Code. We are under Title 29, subsection 7907. We're a non-judicial agency of the courts, and we're located within the judicial branch. The reason I believe we have been located under the judicial branch is because the commission reviews the work within several departments that fall under the executive branch. And the purpose of the commission is to monitor the quality assurance system for nursing home residents in both privately operated and state-operated facilities, with the goal that agencies responsible for the oversight of the facilities are coordinating efforts to achieve optimum quality outcomes. The commission wants to make sure agencies are performing their assigned tasks within a timely fashion and at an optimal level of care.
Okay, and so a little bit about what the commission does. I'm just going to wait for my, there we go. So part of our statutory requirement is to examine policies and procedures, evaluate the effectiveness of the quality assurance system for both nursing homes and assisted living facility residents. The commission provides recommendations to state agencies and the DHSS cabinet secretary as needed. In addition, the commission, the members monitor data that's presented by various agencies responsible for the oversight of the delivery of those services. That includes reports such as the Quality Assurance Review Team or QART report and the staffing report. Both are presented quarterly by the division or to the commission by the Division of Healthcare Quality. Other agencies provide data as well. That's reviewed by the commission members. Some of the information that we review annually include things like Medicaid applications, processing time. We're interested in dental issues for services for individuals in long-term care facilities. Further, the commission analyzes trends regarding the quality of care and the quality of life for residents who live in Delaware's long-term care facilities. We do this by researching what other states are doing through several avenues. We use listservs, we network, we attend state and local webinars to inform ourselves. The commission makes sure complaints of abuse, neglect, and mistreatment, also financial exploitation allegations, are responded to in a timely manner. Sometimes the commission staff work with the Division of Healthcare Quality's investigation section and the Attorney General's office if we receive allegations of abuse and neglect in a long-term care facility. Margaret prepares an annual report. That report is published to the governor, the General Assembly, and the DHSS Cabinet Secretary. Our annual report also appears on our webpage. Continuing about who we serve. So that would cover adults 18 years and older, skilled, intermediate, or assisted living facilities. We serve residents with both cognitive and physical disabilities, and they can be residing in a long-term care facility either temporarily or for a permanent stay. We also will serve individuals, children from age birth to the age of 21 in the pediatric long-term care services for children. And then just a couple of other things that didn't fit neatly there that the commission frequently does. Majority of our total membership of the commission will constitute a quorum. We have to have a quorum in order for us to take official action. The commission can adopt rules and bylaws as it's necessary to perform our operations. The commission meetings and activities, we use Robert's Rules of Order. The commission is operated within the annual appropriation and other funds appropriated by the General Assembly. It provides for our staff, and the Department of Justice provides legal advice to the commission. So we have an assigned attorney general, and that would be Karen Volker.
And then to try to give you an idea, currently there are 50 skilled or nursing home facilities in Delaware. As of February of last year, when we created the report, there were 5,106 individuals. There are 34 assisted living facilities in Delaware. And again, as of February last year for DHSS's Joint Finance Committee budget hearing, there were 3,315 residents. You know, one thing that hasn't really been mentioned in the budget hearings in the past is a high number of rehabilitation beds. A lot of the facilities have, over the years, added rehabilitation beds. So for example, someone maybe even in their 50s or 40s had hip surgery and needs rehab, they'll go into one of the skilled or the nursing home facilities for some services. In those facilities, sometimes you have a really big turnover each month. Number of residents can be between 80 and 100. In more traditional nursing homes, the turnover might only be a handful of residents in a given month. I do want to mention though, in December 2019, there were 74 developmental disability clients that were receiving nursing home level of care in the facilities. I do want to mention that by the year 2030, Delaware is projected to have the 9th highest proportion of persons aged 65 and over among states. And according to DHSS, population will grow 15% between now and 2025, and 27% between now and 2030. So we've got a lot of growth that's going to be happening in the upcoming years. I'm trying to switch my slide. Here's an article that I had pulled last year in February from the Delaware News Journal. There's good news for older Americans. We're living longer. In fact, by the year 2030, all baby boomers will be older than 65, expanding the retirement age group to 1 in 5. This means a significant population of aging Americans must plan for an extended life expectancy. Now, I wanted to mention to you about outreach. We receive a lot of communication from family members, residents in facilities, other agencies, hospitals, colleges, the list goes on and on. They're reaching out by telephone, emails. I've received lots of text messages. We get letters. We get people that just drop in to see me in my office. But we too go out to the facilities on a lot of different occasions and attend many events to be able to provide awareness of who we are and what services we can help with. We have our webpage, which is located under the judicial branch. We have a brochure that I believe was included in your packet of information. And we also do presentations for different events. As a matter of fact, I believe last March, we presented to a group of University of Delaware student nurses. I also receive a lot of outreach from other legislators as well, and other regulatory agencies trying to be able to figure out a solution for someone that's either looking for care or is in a facility and needs some help navigating. I can tell you that during the pandemic, we have had a lot of individuals reaching out about residents' rights, about hospital stays, communication. And what we do is we connect the families with, the appropriate individuals. Okay, pass it on to Lisa.
So this next slide talks a little bit about who we worked with, and we've touched on that a little bit. But as you can imagine, you know, life isn't a straight line journey. There are ups and downs, and part of what the commission has seen over time is that you know, people's lives are much like not having a straight line, and what we mean is people will have a health condition, they'll go to the hospital, then they may need to have a short-term stay in a long-term care facility for rehabilitation, for a hip replacement, a knee, something like that. Then they return to the community, they live for a few years, something else happens, then maybe they have to visit another long-term care facility again for rehab. They may go back to the community. And then as they continue to age and their life circumstances change, they may need to have more care than what they could receive in the community, but less care than a skilled facility. So they'll move to assisted living and then maybe progress to a long-term care facility. So as you can see, you know, it ebbs and flows. And so we often see many of the same issues. And sometimes people come back to us more than once with new issues or things that they have questions about.
I was hoping to be able to give you all an idea of some of the case studies that we've had. So to give you an example of one of them, my office currently is over at Developmental Disabilities Fox Run. And while I was in my office working, I had a developmental disability caseworker knock on my door and ask if I could join a meeting they were having involving a client's family member. It was a client's brother. And I learned that the client had been living in a group home and then was hospitalized. At that time of the meeting, the client was receiving rehabilitation services in a Newcastle County skilled or nursing home facility for 2 days. And the facility was already saying that the individual had plateaued out during physical therapy and occupational therapy, and they wanted to discharge the person back to the group home. Well, the client had broken a femur and had been receiving one-on-one services in the group home and the hospital, but it wasn't the case when they went to the rehab center. And the client's mom in her 80s was sleeping in a chair because she was afraid her adult daughter would be harmed without appropriate oversight due to her intellectual disabilities. I was able to connect developmental disabilities and the skilled facility staff with the family to be able to develop a care plan the very next morning to be utilized while the client was there, and to be able to come up with a safe plan once the person was able to go back to the group home. It would ensure, you know, success for the client and to have a better outcome. That was one example. Another example, I received a text from a Delaware state official regarding an individual residing in Wilmington's VA hospital in Ellesmere. The individual was having a challenge on trying to get their loved one into a facility. Wilmington VA was going to accept them into their community living center, which is 40 beds, and then they decided not to at the last minute. So I reached out and was able to find somewhere to be able to help this individual. We've had like a lot of different situations where, you know, some of it is just learning and understanding, working with the facility to be able to look at some of their policies, especially if they're not familiar with some of the new technology that's available, to be able to help care for an individual when they're in their facility. There are times I've received phone calls from DHSS's long-term care ombudsman to be able to help facilitate meetings with staff and residents regarding care plans. I had an individual one time at a state-operated facility. They had a resident in his late 20s. He had been part of a gang and was shot while visiting Delaware, paralyzed from his neck down. And the resident had a 6-year-old daughter living in the South who we miss dearly. So, I made sure that they added to his care plan that staff would assist with phone calls or FaceTime daily with his daughter at a time suitable for her at age 6 in kindergarten, so they could remain in contact together.
And those are just a few of the different types of things that Margaret is contacted with, daily to try and help resolve, provide information. We wanted to take this opportunity to provide some information regarding some of the challenges that the commission has observed with the long-term care nursing industry here in Delaware. And workforce is certainly one of the areas that is a challenge, both for the state facilities and the private facilities. Even prior to the pandemic, it was difficult to recruit and retain quality nursing staff, CNA staff to provide quality care for residents. Another challenge that we've observed is, leadership changes happen from time to time, and sometimes transitions aren't always as smooth as they could be. And that happens with state agencies and with the nursing facilities themselves, the healthcare providers within the facilities. Just doing advocacy for individuals can be a challenge. That's why Margaret is really great at keeping a list of people she contacts and networking with others, because you have to know who to talk to in order to help provide that information or learn about where we can effectively advocate to make a change. For the commission itself, the membership appointment process had been a challenge. More recently, since we've updated our statute as far as our membership, that process has gone a little more smoothly, but ensuring that we have all of our vacancies filled has sometimes been a challenge. And then we wanted to share some of the opportunities that the commission has seen. We see the opportunity to verify information through the Adult Abuse Registry to make sure that individuals who are being employed in the long-term care facilities here in Delaware are appropriate. We want to ensure for our membership of the commission that commission members aren't held over. Sometimes that causes some issues in getting our official business handled. We see the opportunity for creating an elder caucus. There had been an elder caucus in the past, and we believe that would be beneficial in the future. We'd like to better be able to address issues regarding the aging population in Delaware, and we feel that this commission is one good opportunity to do that. We'd like to see ombudsman training. While they get training, we feel like there are some gaps in that training, and we could offer some suggestions related to that. A centralized education center, CNA or dietary aid or activity aid cross training. And the reason we believe that's really valuable is because, many of these types of services, they cross over, and they're all part of the quality care continuum in the nursing homes. And we see that as a value. And the commission also feels that it would be really important to value the workforce. few additional opportunities we'd like to mention. There's opportunities for both community and facility-based advocacy. As I've mentioned, advocacy can be challenging. Many of the family individuals are exhausted from taking care of their loved ones and going with them on this journey. And they just don't know who to speak to or what professional to go to. And the commission is certainly a safe landing space for them. And we'd like to be able to have resources for everyone to have a voice. And we see ourselves as part of that. Gaps in service. There are pockets of services that are not being addressed fully in Delaware. As a result, many Delawareans are sent to other states for services. And some examples of that would be individuals with traumatic brain injury, individuals who are on ventilators. Many of the nursing home facilities in Delaware do not have the expertise or the staffing to provide care for those individuals. Staffing ratios in the licensed facilities. Senator Marshall, he and this commission worked on creating what's known as Eagles Law. It's a staffing law for skilled and nursing homes. We at the commission review those statistics, and we feel like it would be appropriate to look at updating that particular law to ensure that quality of care is really at the forefront. And the workforce, as we've mentioned, just to empower individuals in this field and in all healthcare environments to ensure that the individuals that they're serving are being cared for appropriately. And we would be remiss if we didn't talk very briefly about what we've been doing since this presentation was prepared in relation to the COVID pandemic. So just a few things to mention. Both Margaret and I have been participating on the state health operations calls with the long-term care facility providers. The commission's been reviewing COVID-19 statistics daily, particularly those that involve long-term care residents. The commission and Margaret in particular have been interacting with state agencies, stakeholders, and families throughout the pandemic. The commission has been analyzing and providing feedback on proposed policies for long-term care residents. Some of those policies included the reopening plan, the visitation plan, the support person guidelines, and many more. We've been attending vaccine distribution subcommittee meetings, frequently attending hospital and long-term care provider info sharing meetings. And finally, we've been compiling a list of recommendations for quality of care during the pandemic that we hope to be able to share when we get to the other side, to look at the things that went well and things that were opportunities for improvement.
We'd like to thank you very much for the opportunity to be able to showcase the commission, and hope that in the future, if anyone has any concerns with someone that's in a facility, to please reach out to us. My contact information is provided there. And if you'd like to connect with Lisa, I'd be happy to provide her information as well. But we're going to open it up now if you have any questions. Thank you.
Thank you very much, both of you, for your presentation. I'd first like to turn it over, and we can actually stop sharing. There we go, so everyone can see each other. I'd like to turn it over to the committee members, and I will do my best to keep track of the list as I did last time. And I see Representative Griffith has a question first.
Thank you so much for your presentation, Margaret. It's good to see you again. I had the good fortune of working with you several years ago when I led Attorney General Biden's Senior Protection Initiative, and I know you were a valuable member of that group. So it's nice to see you and continue to see you with the organization and see you here today. I do have some questions just to clarify. I do appreciate the presentation, but if you could get to specifics on some issues, let's talk, I think most recently, I think what we're interested in right now, particularly that we're in the midst of this pandemic. You mentioned being involved in some of the COVID responses, being involved in meetings and jumping on calls. Could you let us know specifically what actions your agency took, what reports were written and sent, other than being on calls and meetings? I'd like to know specifically like how many individuals the agency dealt with, how many calls did you take from family members or residents of long-term facilities? How many reports, opinions did you write in reference to some of the policies? So if you could quantify, please, your work in the last 7 to 8 months, other than attending meetings and being on calls, just to tell us specifically the relevance of your voice on those matters. Thank you.
Sure, thank you. During the pandemic, roughly 40 individuals a month reach out to me for various issues. Some of them are in the hospital needing help, or some of them are individuals that are in the facilities currently. As far as the meetings that we're attending, the State Health Operations Center, we provide a lot of questions back to the State Health Operations Center, in particular on like the reopening plan, support person, anytime they're trying to make changes after, after they've updated a plan. We're in constant contact with them and the Division of Healthcare Quality as well. We also reach out to other areas such as the Alzheimer's Association and other groups to see if they can participate on some of the calls to provide extra resources to the long-term care facilities as well.
And I would just add that a lot of the things that we're doing during the pandemic are not necessarily things that I would describe as a written report. Certainly for the reopening plan, the visitation plan, the support person guidelines, the commission submitted written comments to long-term care, for the Division of Healthcare Quality rather, to take our comments and suggestions into consideration, but it was in a less formal, not necessarily a report type presentation, if that makes sense.
Did you officially write your opinions on those subjects and give them to the commission? I mean, how was this comments and meetings, or was this actually written comments and feedback?
They were written comments, correct, Margaret?
Written comments. Now, please keep in mind, we during the pandemic also have open public meetings where we have invited others forward, like Dr. Pescatore came and spoke during the meetings. Each meeting we have an open public forum. We have the Division of Healthcare Quality there, where members and others from the public can ask additional questions as well.
I also wanted to ask about the adult abuse registry. You mentioned being involved with that and working with that. How is that so? I understand that's something that's run. Those qualities are those checks are run through DHSS. So tell me how your agency is involved with adult protection registry issues.
Well, I mean, during the pandemic, there have been issues with folks being able to go over and get a background check. Limited hours, limited slots available. Those are some of the things that we comment.
And that particular issue, not being able to get an appointment, affects the workforce. So they're not able to bring on new staff until they've completed that, abuse registry check. And so if there's a backup in the system, that of course concerns us, because the quality of care would be affected if there's a shortage in the workforce.
Okay, so I'm sorry, I was a little confused. So that was an issue that you flagged as being important. And when that was brought to your attention that there was a problem, how did you handle that? What did you do?
Well, we've been in touch constantly with areas under DHSS to be able to get that resolved. A constant thorn in their side a little bit to be able to make sure that it's on their radar and that it's important.
And your 2020 report, has that been issued yet?
Our annual report?
Yes, the one that was, I think the last one I saw available was from the end June 30th of 2019. Is there something that covers up to 2020 of June?
I think, didn't we just approve?
I don't know if it's on our website, but I believe we just recently approved the 2020 report. As you might guess, sometimes there's a little bit of a delay, particularly working, remotely and so forth. And Margaret doesn't have direct control over the website. She has to submit through the AOC in order to get things published.
Okay, thank you. Yeah, just to note, I didn't find it up there. I think the last one I saw, I think covered 2018 to 2019. Thank you, Madam Chair. I have no further questions.
Thank you.
If there is an updated report, and would you share it with the staff so that they can disperse it to the committee?
Absolutely, absolutely.
Thank you. Representative Yerrick was next.
Thank you, Madam Chair. Thank you for the opportunity to learn more about the commission. Just a couple questions. Could you tell me again, what is the size of your staff? How many people work with you?
Just me.
Just you, that's what I thought.
And I have a handful of commission members, yes.
So you're an army of one.
Right.
And taking some notes, there are 50 skilled facilities and 34 assisted living facilities representing over 8,400 individuals. Is that correct?
Give or take, yes.
With all due respect, what are your main objectives? What can one person expect to accomplish in regard to trying to monitor, oversee, provide value in regard to 84 facilities and 8,400 plus residents?
Well, if you look at the list of members we have, commission members, they all have roles. For example, Lisa is a patient advocate.
I work for the Community Legal Aid Society, so I work for the Protection and Advocacy Agency for the state of Delaware. So that's one area of expertise that I bring to the commission, and we have many others. So we try to share part of the workload with Margaret, so to speak, and as much as we can, because we are a volunteer commission.
And we do a lot of networking.
If you encountered an issue at a facility, what sort of authority do you have to officially question what's going on there?
I would report it. I'd have an investigation done. And I do that quite often. And then they would send me the follow-up on it.
Based upon your professional opinion in regard to the current number of beds that we have and the demand that's out there, what sort of capacity should we have in regard to long-term care facility beds to meet the needs of current Delawareans and as well as the future Delawareans with the aging population?
Are you referring to during the pandemic or our population period?
Population period.
I'd have to think about that just a little bit.
Last question. How does the certificate of need, which was an area that we were presented last year, how does the certificate of need issue present opportunities or challenges to add additional beds or facilities who want to add additional beds to the state of Delaware?
I'm happy to let you know. Whatever you have.
It's an area I would actually like to become more involved. When they try to decide if we need additional beds, I have not been a part of that group. I know that I've received a lot of calls from different legislators at times there. So I definitely think that we need to take a look at our entire state before we decide we're going to have another skilled facility or another
Right.
assisted living. I know that we have some areas that we haven't been serving, such as the brain trauma injury, folks between 18 to 59-year-olds. We have a big issue in sending them out of state.
And those that are ventilator dependent as well. So I mean, I think there are certainly some gaps where, you know, having more beds would be beneficial. And I think, you know, you have to look at the whole system. And part of, to me, looking at the whole system would include what's available in the community to support folks safely, and how the continuum of care would work.
Not in Delaware. My father, who passed away in 2019, was in a long-term care facility for several years, and the challenges of workforce issues and hiring and retaining individuals is a challenge in, I would say, 50 states, not just Delaware, or 49 other states. One last question. How many of our current beds are allocated towards Medicaid recipients?
I would have to take a look, but I can tell you that the majority of the assisted living are not, which I'm starting to receive a lot more calls from the DC area about that. And that might be something that we definitely should take a look at in the future. As far as the skilled nursing homes, I can tell you, since I've been in my position and it just turned 14 years, a lot of them years ago did not have Medicaid beds. A lot more of them have added Medicaid beds over the years. So I'm going to say the majority of them have it right now.
Yeah, it's a challenge. I mean, out-of-pocket expense, what, $70,000, $80,000, $90,000 a year for a long-term care facility. And
yes,
the individuals that cannot pay that,
right,
let alone individuals who are not even remotely close to paying that, such as on Medicaid. I mean, there's no easy solution that hopefully we can continue to look at that to try to find some more capacity to serve really our most vulnerable individuals that will and do need long-term care. Appreciate the time. Thank you.
Thank you.
Thank you, Representative Yerrick. I'll follow up with a couple questions while the rest of the committee, I'm sure, is pondering a lot of the information you shared with us today. I just wanted to go back to the very beginning of your presentation, and I know that history can sometimes be, you know, what we're trying to move forward and create new things. But I thought that the history of your organization or your organization was helpful in the sense that you talked about the mission and the why. And it seemed that at the time, now I have to admit, I wasn't paying attention to state politics back in 1997, but it seems like at the time, the concern was really the increase in complaints, and that, you know, this organization, at least in nascent stages, was meant to address some of that. And I'm wondering what you've seen. I know since 2007 is really what you can speak to, but how you feel that the organization over the course of its lifetime so far has addressed that original concern, and maybe help us understand, have we seen increases in populations and subsequent increases in complaints? Have we seen increases in populations and decreases in complaints? Is that related to the work you're doing? Or I would just like kind of an idea of how you're looking at the industry and your role as it stands today as compared to in 1997.
Well, I think that when I started, you know, everyone kind of lumped all nursing homes together, saying they were all the same, and they're not. Some of them specialize, you know, more on rehab services or cardiac or what have you. So they're not the same. I can tell you that before the pandemic, I'm in the facilities all the time. Whether it's a follow-up to an annual survey, I'd like to hear what the residents have to say once they hear what happened, you know, during the survey. As far as complaints, I think there's always going to be some complaints. I think that we still need to address workforce shortage and folks wanting to work in this industry. It needs to be more attractive. They need to feel valued. And so we have some work to do on that. But I can tell you that the Division of Healthcare Quality, you know, I have a really good relationship with them, working on complaint surveys. When something's happening in a facility and someone reaches out, they want to be heard. And they want to know that someone cares and is going to do something about it. So I think we have continued to come a long way. I think we still need to expect more from facilities that are providing service to individuals. Hopefully that answered your question.
No, I appreciate it. And just to follow up, I think we look at improvements and they can come from a couple different, they can arrive in a couple different ways. And I noticed in some of the public comments that we received, written public comments, folks talk about regulation. When I heard your presentation, though, I felt that it spoke very much to advocacy, right? A lot of your opportunities that you dubbed them are things perhaps that the legislature should take a look at, not necessarily something that you would work on as a board. And so I'm wondering if you could share a little bit more about the regulation side and help us understand the role you play in regulations in suggesting new or maintaining, and how that kind of links back to the monitoring of this industry.
So I think I'll start to answer that question, and Margaret can certainly jump in. So the commission regularly looks at the regulations and the various laws that cover nursing home quality of care issues. And through testimony that we hear from the public and information and our own experiences that we bring, we're able to see where there may be gaps in the regulations. And so to the extent that we're able, the commission strives to work with the Division of Healthcare Quality often, who is working on updating regulations. And we seek to try and provide input prior to them even publishing, what those regulations or the updates might be. Kyle Hodges is a member of our commission, and as you may know, Kyle is a staff for the State Council for Persons with Disabilities, which has a policy and law subcommittee. So we will frequently, he is able to also bring to the table some of the things that group is working on so that we can comment on and we can support changes to laws and regulations that would promote the quality of the nursing home industry in Delaware. And then I don't know if you have anything to add, Margaret.
I was going to say, I recently reached out to the Division of Healthcare Quality about updating the assisted living regulations. There was work done on it about a year before the pandemic hit with their former director, Mary Peterson, and time ran out. And so I readdressed it with them recently and said, we need to start working on this again. We're pushing to try to make priorities within other areas.
Okay, I appreciate that. I might follow up again in a bit, but I appreciate that. I wanted to make sure, because there's a couple other folks who have questions. I wanted to, and Amanda, did you have something from an analyst side to speak about the regulations?
No, thank you, Senator. I just wanted to let you know that Representative Dorsey Walker had a comment. She was next. Her hand raise feature wasn't working.
Oh, thank you. Fantastic. Real quick, Representative Dorsey Walker, I just wanted to ask several of the public comments raise the issue of board vacancies. It sounds though through your presentation that you only have one vacancy. Do you feel that this was an issue that's been addressed? Is there something else we're missing about potential vacancies that could hold this organization back?
We did have some vacancies, and we had legislation that was introduced and passed. It was House Bill 62 with House Amendment 1. It was signed by the governor June 5th of 2019. Back then, we had 7 governor-appointed vacancies that we were trying to get filled, and it was a challenge. Since then, when we updated the legislation, we pulled out political party, which was part of our original, and we, made some technical corrections. We changed some positions around a little bit. The biggest thing was appointing authority and political party was a big caveat that was fixed with this legislation.
Okay, fantastic. Do you feel that there's any skill sets missing from the makeup of your board?
I'd like some more help. I mean, it would be nice to have some more help to be able to grow with this. When I started in my position years ago, chairman was Tom McGonigal, and love Tom. He was able to be down at Legislative Hall a lot. Lisa and I both are advocates in our worlds, so it'd be nice to have another set of legs to be able to come down to Legislative Hall a little bit more. I try to come down a couple times a year during like World Elder Abuse Awareness Day or some other pieces of legislation that are going on the floor, but it'd be nice to have some more help.
And so are you saying from a staff point of view?
Absolutely.
Okay.
I can tell you that in the past, we've tried to have second and third year law students that have wanted to intern for us. We didn't take it up at that time, but whether it's on a volunteer basis or permanent staff, it'd be nice to be able to spread out a little bit more and focus on a few issues that are outstanding.
Okay,
Thank
you.
I'm sorry, I was just going to add that I think as far as the membership of the commission itself, I feel like we have a pretty good mix from all types. We have folks from Newcastle, Kent, and Sussex. We have people with lots of different skill sets. We have people that are current or former recipients of long-term care facilities or reside there now. So I feel like we have a pretty good mix at this point.
No, I appreciate that, but I appreciate the comments on the staff side as well. Representative Dorsey Walker, thanks for that indulgence.
Oh, no problem. Thank you, Madam Chair, and thank you, Amanda. Just really quickly, Madam Director Bailey, you mentioned about Eagles Law and quality of care. What is it specifically that you would like for us to address regarding Eagles Law, and how can we help you?
Well, so when Eagles Law was formed years ago, not as many facilities had a rehab section. So what I find happening is you have maybe a building that has 150 beds. You might have 160 of them are rehab beds, and the 40 are folks that are there for long-term, okay? As long as within that building, they're meeting the staffing ratios, there isn't an issue. However, I believe it is, because you've got people that are on the rehab side that might be more acute versus the other side, there isn't an equal balance. So I definitely think we need to take a look at staffing when it comes to that. And I also think we need to create staffing ratios for assisted living. We have what's the saying? The folks that are in the assisted living facilities nowadays were the ones that were in nursing home years ago. People staying in the assisted living, they're only in there for about 2 years and then they move on, but they're declining very quickly in those 2 years. We need to look at assisted living and staffing for them.
What would you suggest the ratio be for assisted living?
I'd have to look at it because some of the facilities have like a memory care section and some do not. And I definitely think that that plays into the staffing ratios.
And
Thank
if
you.
I, could I just also comment in regard to the staffing ratios and to answer your question? One of the things that I didn't share is that I am also a CNA in my part-time free time, and I worked in a long-term care facility for about 2 years. And as a CNA, and I worked the 3 to 11 shift, and I am noting that for you because the staffing ratios are specific to weekday, each day of the week, including the weekends, and by shift. And so it is really darn hard to take really good care of people the way that you should and that they deserve to be cared for in 2.5 hours or the 3 hours that's allotted depending on, you know, the day of the week and the shift and so forth. And it sounds like a lot, but I can promise you it's very little. And so I would like to see the ratios increase so that residents are getting more hours of one-to-one care on each shift, because that's really where they're going to get the quality. That's where I believe the workforce in some ways will be able to retain good quality staff.
Maybe Senator Gay and I can reach out to you offline to figure out how you would like for this to move forward, and we can work together.
That'd be great.
Great.
Thank you.
Thank you.
Thank you, Representative. Senator Pinckney.
Thank you, Madam Chair. Thank you, ladies, for your presentation and for the information that you provided us today. In my other hat, I am a case manager at Christiana Hospital. So I work very closely on the acute side, where very often we discharge those patients to the nursing facilities throughout the state. So I definitely agree with you when you talk about our shortcomings when it comes to caring for patients with ventilators. We have one vent approved facility in our state, and we have very little resources, like you said, for those suffering from TBIs and also those suffering from spinal cord injuries, two populations who very often need long-term care after their injuries occur. So thank you for bringing awareness to that. Senator Gay actually touched on one of my questions about regulation. My other is around Medicare ratings. I'm curious of your familiarity with Medicare ratings, and if you see any correlation with those ratings in the facilities that you receive complaints from or receive complaints on most commonly. I'm asking because I'm curious about the actual effectiveness of the Medicare ratings and what are then reported out to families who often use those ratings to choose the facilities that they're going to send their families to, particularly for rehab, but also for long-term care.
So Nursing Home Compare isn't the way it used to be, especially during the pandemic. A lot of information doesn't have to be reported like it used to. But I do definitely think there's a correlation with complaints versus performance. Definitely in the past. Again, if you look at Nursing Home Compare right now, it isn't the most accurate tool based on the pandemic.
Thank you. That's my only question.
Thanks.
I'm sorry, I was on mute. Representative Johnson.
Thank you, Madam Chair. Just a few questions I have here. So Executive Director Bailey, one of the tasks that you mentioned included following up on nursing home surveys. Can you give me just paint a picture of what that looks like? So nursing home, they have their survey, perhaps they have several recommendations that need to be followed up on, and then you go out, like walk me through that process just so that I understand how you are connected to it.
So in a nursing home setting, there is an annual inspection that's performed
Right.
at the state level. And then after it, our commission has written in the legislation that they will have a post-survey meeting to follow. So I go out to that post-survey meeting that facilities are supposed to let family members know and residents so anyone can attend. And then we'll join them to hear what was found during the survey. And then hear feedback from residents. A lot of times when we're there for that, residents will pull us aside and say, this is what's happening too, or whatever. So then we'll do follow-up and make sure that things have been addressed.
Okay.
And we'll stay in touch too with the Division of Healthcare Quality. If some type of a complaint needs to be looked at again, we'll be happy to open it up.
I would just add that some of the survey findings may require civil monetary penalties, both from the state or the federal level. The commission does review civil monetary penalties annually to, one, ensure that, you know, if there were deficiencies that were found from the survey, that and all the appropriate follow-up was done, and then that civil penalty money goes into a pool that can be used for certain educational opportunities in the industry and other things. And so we will sometimes make recommendations and follow up on things that the civil monetary penalty money is used for.
Okay. Thank you. Let's see. On your slide, and you actually mentioned this a few times, and you talked about challenges, and you talked about the challenges related to the workforce, and also I think the turnover and leadership. As it relates to the general workforce, the nurses and the CNAs, how do you believe that problem can be fixed?
I'm gonna maybe start. So one of the things that we didn't mention in our presentation, because we could have talked about lots and lots of things, but we know that there's a limited time. One of the things that we've been very interested in is looking at the quality and the pass-fail rate of the CNA schools here in Delaware, because the focus is on providing quality care. So if you haven't received quality education in order to pass the certification process for a CNA, then you cannot provide quality care in a skilled facility. And so we have worked with the Division of Healthcare Quality to review the data of the various the schools here in Delaware, to look at their passing rate, both on the written exam that's required for a CNA and on the hands-on practical exam scores for the CNA. And we were quite surprised that there were some schools that had very poor passing rates. And so we advocated for the Division of Healthcare Quality to be following up with those schools. And that's one way in which we are trying to address the workforce issue, both from a shortage standpoint, because if you don't have enough people going through the CNA schools and enough people passing with minimum proficiency, they're not available to be hired into a facility. Maybe Margaret can talk about some of the other areas.
Over the years, I have worked with a lot of colleges as well. I feel that we need to do a recruitment process actually at the high school level to try to get more folks into the workforce. But I have also reached out to, at the college level, a couple of classes, being able to provide awareness on abuse, neglect, and financial exploitation. We need to value an employee's people are going from company to company. Some of the facilities, the turnover is 40% a month. That's scary. We want to make sure that we've got continuity of care, and we need to make sure the people that are caring for others are happy. We need to keep them motivated. And that's one of the reasons why, Lisa had mentioned about, having a centralized education center. It's something that I feel is real important. Not only can we track what kind of education all the healthcare providers have received, but it will give an opportunity to teach me something new, make me valuable, and make me interested in my job. For some reason, people don't feel that long-term care is as glamorous as it is working in a hospital. It's time to change the mindsets, because regardless to where you're working, you're gonna work with folks in this population.
Understood. Thank you. And then my last thing is really more of a comment, not a question. And this is from the conversation that you were having earlier related to ratios. And I will tell you, I am all for ratios. They help, staff provide the highest level of care. It helps decrease turnover, burnout, abuse, neglect, all of that. So let me say that up front. So, I'm so there with you. My concern and what I want you to keep in mind is this: the unintended consequences of prescriptive ratios. And that when the discussion and the planning starts to make sure that those entities that are going to be impacted by a prescriptive ratio plan, that they are at the table. And, the first thing that popped to mind for me was assisted living facilities. And it's a personal reason. My godfather actually lived in an assisted living facility, and his room and board was a little more than $5,000 a month. So the first thing I thought was, oh my goodness, if they had strict ratios, how then does that drive up the price to those individuals living in assisted living? Because assisted living is not Medicaid. Assisted living is coming from people who have planned their retirements and they can actually afford to live in these type of facilities versus being on Medicaid, being in a different type of long-term care facility. So that just to be mindful of the unintended consequences. Assisted living is already out of reach for so many people. And for those who can afford it, I don't want to see them hit further, because ultimately that that cost for additional staff has to go somewhere, and it's going to go on the person who's paying for the service. So just something to keep in mind. Thank you.
Thank you.
Thank you, Representative Johnson. Representative Griffith was next.
Thank you. I have a few more questions, and I'm just thinking of the whole picture and how you fit into it, how the commission fits into it. Years ago, when you were established, the need was really for review, and I can imagine the point of putting this in the judicial branch was to have that sort of independence and oversight into a lot of long-term planning that needed to happen to improve our long-term care facilities. Since that time, I think a lot of the DHSS has, for lack of a better term, beefed up some of those support agencies, including the long-term care ombudsman office. So a couple questions, Margaret. One is, does it make sense that you continue to be located in the judicial branch? And if so, why? Why is it important that you are there in that branch, that the commission's located in that branch? Secondly, what is your opinion or position on, does it make sense to move over to DHSS and sort of support what the ombudsman program does, which is really, in addition to your work, look out for the care and protection of individuals who are living in these facilities in their home, in terms of their role as advocates and doing all that they do for those folks. It seems that again, like you're just a team of one, and that's an enormous responsibility. And there's other organizations within the state that are doing similar work. So I'm just curious as to what you think about, you know, what's the need to continue staying in the judicial branch? And secondly, does it make sense at all to move over to DHSS where you have programs like the Ombudsman?
Do you want me to take that or you want me to?
I think you should talk about the AOC stuff first, and then I might have some comments.
Okay, I don't believe it's the right move, moving us over to DHSS. I've seen other areas that have moved under there and they just got buried. As a matter of fact, we provide a lot of support to the long-term care ombudsman. We actually are their voice as well. And I feel that if we were under DHSS, we would be governed by their way. We look at it from the outside, and we're reviewing many agencies under DHSS. We might not see eye to eye, our angles could be different. And I feel that if we were to be under there, it wouldn't be able to be that way anymore. I like being under.
Okay, can I, that's a fair point. And so is it that you feel that there's a sense of autonomy that you need, and that's, and that being in the judicial branch provides that, so that you can be an independent reviewer of the department? Or if you can expand on that a little bit.
Yeah, I'm going to offer my opinion, which is similar to Margaret's. I think it's almost, for lack of a better way to describe it, almost a conflict to put Margaret and the commission under DHSS. I think it would inhibit her ability, the commission's ability to effectively advocate, because its advocacy is hard to begin with. And sometimes we have differences of opinion. And so if Margaret was put in a position that she had to advocate for something that was directly in conflict with what her supervisors at DHSS had to say, it would no longer be independent and would affect her ability, the commission's ability to advocate the way that I think we need to have that autonomy to advocate.
And we also have a lot of agencies within DHSS and others that reach out to us and say, hey, can you help us fix this?
We're able to be a voice that they maybe can't be because they are in a particular area of state government.
Okay, thank you very much. I appreciate that.
Thank you.
Thank you, Representative Griffith. Representative Spiegelman. And oh, I'm sorry, Representative Dorsey. I think I saw Representative Spiegelman first, and then we'll move to Representative Dorsey Walker. Thank you.
Thank you. I'll keep mine very brief. I don't like to stand in Representative Dorsey Walker's way. Very quickly, this is more to Mark and Amanda. The question Representative Griffin just asked is one that we have been asked many times over the last couple of years, which is the appropriate place for an organization under what department they fall. And we've gotten a variety of answers to that question over the years. Most recently, for members who were on last year's group would recall, with the Criminal Justice Commission, moving them around to different departments. We've gotten this question with the Department of Education. In part of, obviously, this is going to be one of the recommendations, is to perhaps move this to a different department. As part of that recommendation, whether we adopt it or not, it would be helpful, Mark and Amanda, to have a bit of history of what we did with other groups and where we moved them or not, and what the rationale is behind that. Because at this point, during your answer to Representative Griffith's question, I mean, it was I agree with a lot of parts of it, but it's kind of clicking in my brain that desires a single standard for a lot of things, that we've asked this question before, not of your organization, but several organizations, and the answer was different depending on the group. Some groups said, yeah, we do need them to be moved, and we did or didn't. And some groups say we do not want to be moved, and we did or didn't. So we could use a little guidance on that when it comes to it. It's not a question, it's a statement. Thank you.
Thank you, Representative Spiegelman, and I appreciate that, and I agree with you that that context is going to be really helpful as we move forward, so thank you. Representative Dorsey Walker.
Thank you, Madam Chair. Representative Griffith and Representative Johnson, the twins, actually brought something to my attention, and it was around assisted living as well as ensuring that this entity maintains its autonomy. My concern is, and I want to expound just a little bit on what Representative Johnson stated about the Eagles Law, and if we're going to be pushing those costs onto those who are in assisted living facilities if we expand Eagles Law. And I just want to make sure that we're not doing something that has unintended consequences with the right heart in place, but then ultimately it creates an issue for our constituency.
Ms. Bailey, did you?
Director Bailey and Lisa.
Certainly, I think it's a complex issue that we need to carefully look at, because the commission would certainly not want to undertake something that would disenfranchise part of the system or make it more difficult for individuals to access care. But we do see the need to maybe update that law. So maybe a possible avenue forward would be to take a look at the current Eagles Law and get some input from stakeholders about where the gaps in the system seem to be, and then take a look at what that data says. Do you have another comment, Margaret?
Okay. The second part of that is Medicaid rates for the workers. They haven't increased since 2012. Is that correct?
Somewhere in that neighborhood, yes.
Okay, so it looks like maybe we need to be reaching out to our federal partners to
Right.
ensure, as you mentioned earlier, that the workforce is feeling appreciated.
Yes.
Thank you. And I think I heard Representative Griffin mention something along those lines as well. Thank you.
Yes.
Quickly, I just wanted to follow up on what some of my colleagues were asking and perhaps put a finer point on it. We'll see how I do. I have heard you talk about the actions you take. The case studies are instructive, that you have referred, information from other parts of the government, and that you're able to take action. I'm wondering what your the extent of your ability to make change beyond the individual situation. So the individual advocacy piece, I understand. Wondering, it seems like in other places you're making recommendations. Can you tell me of any places where you are? And I do apologize, the youngest and loudest members of my household have returned if anyone hears them in the background. But are there places where you have the ability to be the word, to be, the dispositive voice on making that change, or are you always appealing to another body to do so?
Well, I mean, we do have open public meetings where our entire commission is addressing situations. Sometimes it is them taking it and running with it. We have written to cabinet secretaries, the governor in the past on recommendations, and some of them have moved forward. As a matter of fact, one of them was about adult protective services years ago. I'd have to go back and look and see, but we do make some recommendations too. Yes.
And I would just add, I think the goal of the commission would be to provide both individual and systemic advocacy. I think that there's always opportunities for the commission to improve upon our advocacy efforts. Sometimes the issues, if I'm being frank, we have a diverse group of of individuals on our commission. And like any group of people, we may not always agree as a commission in full on how to move forward with a particular issue and how to best advocate systemically for reform. So like any group or body, we have to sometimes come to a compromise or, you know, maybe change direction from what we initially envisioned as our advocacy strategy. But with that being said, I think, you know, we use the tools that are available to us. I mentioned Kyle Hodges, and I don't mean to, we have many other members that are very valuable to the commission, but because the state council is one of those advocacy bodies that does a lot of systemic advocacy, we rely on him and we try to piggyback on some of their systemic advocacy as appropriate.
I appreciate that, and I recognize the crucial role and the need for advocacy in this space. And I think what might be helpful for me, if it's something that you have, would be information about how other states have addressed the need for individual and systemic advocacy. And that's not something that, you know, I'm asking you to prepare now, but perhaps as a follow-up, you might be able to provide the staff with more context, because looking at those models and looking at our model, I think we can understand more the pros and cons of how we've set up the existing system.
Sure, we'd be happy to try to do that for our future.
At the moment, I'm not seeing any other hands raised. I just want to make sure I'm not missing any committee members who had remaining questions. All right, thank you. I would like to, I'd like to open it up to public comment, but I just wanted to check. I believe the staff has alerted me that there aren't any other General Assembly members or public officials who have requested comment today. Okay, great. Would Mark, would you be able to take it away with public comment? Thank you.
Sure, absolutely. Attendees who are in this meeting, if you want to utilize the raise hand feature, you will be called on in the order that you do so, and I will be able to unmute you, and you can offer your comments. We have 2 minutes for individuals and 3 minutes for those representing a group or organization. You will see a digital timer on your screen. I believe I've worked out all the kinks from last week, so we should be able to do that. First up is Ann Farley, and I am unmuting you now, and you will be able to speak.
Can you hear me?
We can.
Okay, great. Thank you, Senator Evans Gray and Representative Dorsey Walker and members. I am chairing the subcommittee for service to consumers of the Senator Porter's reorganization task force for DHSS. Today, I'm speaking personally and in that role. In March 2019, my 96-year-old mom really faced calamity, and we needed to find a place for her. If I could have reversed the last 6 months of her life, I would. Thinking we were doing what was best for her, we sought assisted care. And what ended up happening was we went through a horrific experience. She ended up breaking her hip in assisted care. I don't want to go into that. She ended up in a hospital. She needed a rehab facility. She needed nursing care and ultimately hospice care. What a challenge. And it was such a critical and scary time in our lives. And the system is fraught with challenges. The one reliable, responsive, and committed resource that we found was through the Nursing Home Commission and Margaret Bailey. Her patient-centered approach helped us find compassionate and quality care for my mom. Her counsel greatly aided my family making decisions. Margaret was there each and every step of the way, and every time I reached out to her for guidance. As you were talking about placing this and where this should go and why advocacy is important, as chair of the of the subcommittee, we are going to recommend that the ombudsman for long-term care also move out of DHSS. In this way, we can ensure accountability and a arm's length distance. It's sort of like having the fox guard the hen house. This DHSS operates their own facilities as well as providing oversight of facilities. There needs to be an independent arbiter of somewhere the public can go when they're trying to find quality care in a private or state facility. And we need to really focus this organization. I don't even know what their name is so long, but it avoids accountability, it focuses on avoiding mistreatment, abuse, or neglect within the population. By my mother's placement in a facility, we were able to provide her ultimately a level of comfort in her final days. And my siblings and I are very grateful to Margaret for the support and services she gave to us. So with this, I just want to thank everyone for that commission and the work that they do, and thank all of you for your due diligence in this process.
Thank you so much for your time and your comment.
Next up, we have Robert Overmiller.
My name is Robert Overmiller. I'm the chair of the advisory council for the SAPID, which is the Division of Services for Adults and Adults with Physical Disabilities. In the fall of 2020, we consolidated, or I should say the SAPID consolidated the state's long-term care facility into one location in Smyrna. So they are only supporting one facility at this point, and that adult elder care and elder abuse also falls under the SAPID. And I know this agency's done good work with communications on these applications and problems that were found within them. And I just thought you needed to have that kind of information given to you. Thank you.
Thank you, Mr. Overmiller.
Thank you. Next up, we have Barbara Webb.
Ms. Webb, are you there?
There we go. Can you hear me?
Yes, we can. Thank you.
Okay, great. Thank you. Good afternoon. My name is Barbara Webb. I recently retired from the Department of Health and Social Services after nearly 40 years of service. I began my career in the department as a Medicaid social worker and then went on to become the administrator of Adult Protective Services, executive assistant to Cabinet Secretary Carmen Nazario, Deputy Director of Long-Term Care Residence Protection, as the division was known initially, and then as the division's training and education administrator. Two forces have always come to bear on the services that residents in long-term care receive or do not receive. One is the political will of the state and federal government to adequately regulate according to the law. Two is the long-term care industry, whose business model is understandably to maximize profits, but sometimes at the expense of meeting standards of care. Firstly, I will address the government influence on resident services. The division is part of the Department of Health and Social Services. The department is responsible for and operates two long-term care facilities, the Delaware Hospital for the Chronically Ill and the Stokely Center. The Healthcare Quality Director is appointed by the Department Cabinet Secretary, who is appointed by the governor. The inherent conflict of interest is that the department operates long-term care facilities at the same time it regulates them. And the division must enforce regulations in a consistent manner, whether the facilities are in the public or private sector. Dilemmas have arisen on enforcement due to this conflict of interest. Secondly, the private sector lobby, the Delaware Healthcare Facilities Association, is the chief lobbying entity that works on behalf of the long-term care private industry in our state. In 2019, Governor Carney approved the retired executive director of that lobbying organization to be the director of the division she lobbied against for nearly 20 years. State government has the authority to appoint regulatory officials, even if such persons—
Thank you, Ms. Webb. I'm sorry, the time's expired, but it seems like you have a lot of information that may be helpful to know in background, and I would invite you to submit public written comments so that the entire committee may be able to review that prior to us reviewing recommendations for this commission. Thank you.
We have one more hand up for public comment. That is Rayetta McCall. Ms. McCall, you can unmute yourself and
Can you hear me?
Yes, we can. Thank you.
Okay. Good afternoon. I provided written testimony to this committee when you were scheduled to meet in March of 20. But I'd like to make some comments now. Margaret Bailey, Executive Director of this commission, is a one-woman office. She handles calls from anyone in this state who needs to talk about nursing home issues, whether it's a family member of a nursing home resident, state agencies, or legislators. She's been there for all of them and not just 9 a.m. to 5 p.m. She believes in quality treatment for those who most times do not have a voice. She mentioned outreach. Many of those who need the commission have never heard of it. Over the years, I visited several friends and in different nursing home facilities and saw what happens when a resident does not have an advocate to speak up for them. I have personal experience in knowing what it's like to have a loved one in a facility. My mother was in 2 facilities for rehab both times. I had to take her out of the facility by ambulance as a result of poor care. Because I am familiar with nursing home care, my mother had someone with her every day of the week, either myself or an aide that I personally paid for. I recognized issues and was able to get my mother out of the facilities and to the hospital quickly. I completely support the Delaware Nursing Home Resident Quality Assurance Commission and feel this commission is essential for the protection and advocacy of Delaware's aging population. It'd be interesting to know who doesn't think that this commission is important and what reasons they would give. Maybe they need to have another Senator Marshall type of community hearings on nursing homes and see how many people would be there to tell you what is needed again. I look forward to seeing what you do next regarding the sunsetting or not of this commission. I'd like to believe you would not sunset it and do the right thing. In the end, there's much to talk about, to say about the workings or not of nursing homes. However, this is not the committee to do that. Thank you.
Thank you so much. I appreciate that, Ms. McCall. And thank you to everyone who provided public comment. Mark, is that the end of our list today?
That is the end of public comment. Thank you, Senator.
Thank you. And I just want to thank everyone who provided public comment today. As many are aware, we are the Joint Legislative Oversight and Sunset Committee, and in that way, we both seek to assess the value of boards and agencies and organizations and seek also how we can operationally help them continue to better serve Delawareans. And so I appreciate everyone that came out to speak in favor of the work that's being done and appreciate all the questions that the committee asked. I thought it was a good discussion today. I'd like to thank our 2 guests and appreciate you spending the time with us to help us understand your work, and look forward to following up with you and continuing that conversation as we move through this process.
Thank you.
Are there any questions before we move to the next agenda item? All right, seeing none, I'll just ask if our guests, it seems like they are entering now from DIAA. We'll just wait for Dr. Layfield.
If you would like, Senator. Oh, I do see Representative Dorsey Walker has her hand raised.
Yes, Representative, how can I help?
Sorry, Senator, Madam Chair. I also wanted to point out that we had about 13 letters of recommendation for this entity for the work that they're doing in the community. Thank you, Madam Chair.
Thank you.
Thank you. Absolutely. And those were very helpful, at least in my review and preparation for this meeting. All right, so we have Ms. Polk, Mr. Rodriguez. We'll be waiting for Dr. Layfield to join us. And just a reminder that we're going to now review as a committee the draft recommendations for DIAA that were circulated by Mark. And we're going to start by asking him to give a brief overview. Considering the time and the fact that these are draft recommendations, I would like to proceed by asking Mark to give that overview and to allow the committee members to ask questions and follow up with the recommendations, not necessarily any particular order, but where you have questions, concerns, comments. So if there's no objections moving forward that way, I think that might be most efficient for our time at this point. Okay, I would like to just wait for Dr. Layfield if everyone could bear with us.
Senator, if you'd like, I can just very quickly bring everybody up to speed on where we are in the
Terrific.
review from last year. So as I get the pinwheel, these draft recommendations that you received on Friday are kind of a compilation of basically 3 areas of research and observation: the draft report from last year, from 2020, as well as progress reports from DIAA in July, September, and December of 2020, as well as observations made by all of you last week. So that is kind of just kind of what I wanted to put out there now. Now, for recommendations 1 and 2 are kind of the standard JLOSC boilerplate recommendations based on 1, based on our statute, and 2, based on the standard recommendations over the last few years that we have done to update older statutes and kind of bring them into conformity with the Delaware Legislative Drafting Manual, as well as kind of other mirror operations. So if that's okay with everybody, I will then share the.
And while Mark's pulling that up, I'd like to clarify that it's not necessarily that we have to work all of these recommendations in the same meeting. So for instance, if I'm happy, I think it's important for us to look over the draft recommendations in total, address any concerns, and allow DIA folks to give us any feedback that would be helpful. I'm happy to also at the end of that entertain a motion for some or a portion of the recommendations. We can also address that at our next March meeting. So we have some flexibility here. I think that the discussion that we have about the draft recommendations is going to help lead us down the right road. So just want members and committee members to feel free to add your feedback freely as we go through.
I will not read them verbatim in interest of time. Recommendation 3 deals with the strategic plan that was mentioned at the presentation meeting. Recommendation 4 deals with the expired terms that some members of the board are sitting on. Recommendation 5 makes a couple draft changes to the composition of the board, as well as adding typical language for removal of a board member. Recommendation 6 deals with the structure of the board meetings. 7 makes changes to the standing committees and how they are currently set up. Recommendation 8 tries to address some of the staffing issues that were discussed last week. Recommendation 9 deals with the statute change to allow DIAA to pursue non-tournament related revenue fees. Recommendation 10 deals with the issues surrounding Senate Concurrent Resolution 79 and out-of-season coaching. Recommendation 11 deals with updates to the website. Recommendation 12 is a follow-up report over the next year. And then recommendation 13 is the standard one for all of our reviews. So if anybody has any questions, concerns, anything I missed, please let me know something you want to see and haven't. Like Senator Gay mentioned, representatives from DIAA are here to add clarification as well.
I'm on mute. I apologize. I was looking at a piece of paper instead of a screen for once. And so the first person on my screen is Representative Yerrick. So I'm not sure who was first, but Representative Yerrick, please take it away.
I was first. No.
Okay.
Just a point of clarification in regard to the ranking of the recommendations. Most of the feedback that I received prior, during, and post our initial, the initial review last week is around the out-of-season coaching. Perhaps a statement or a recommendation that or my opinion, I would welcome that position, that recommendation to be moved up and perhaps shrink the time frame that we're giving them until the end of this year. I would welcome Dr. Layfield's response to that, whether that's something that could be accomplished sooner rather than later in 2021. Again, for me, that's probably the highest priority of all the recommendations, is the out of season coaching regulations and cleanup and clarification. That's from feedback that I've received from a variety of stakeholders.
Dr. Layfield, would you like to address any comments there?
Certainly. I, as the board chair, as long as I'm still in this position, would like to expedite the coaching out of season regulation as it pertains to what our interscholastic coaches do with their high school students in the high school setting. We, as I mentioned last week, Rules and Regs Committee did make a recommendation for a portion of this that as it pertains to a high school coach who also coaches in a private club or league, that the recommendation out of the Rules and Regs Committee to the board was to change the language that says that, they are permitted to coach their high school students out of season when it's not in the capacity of an interscholastic coach, say within a high school. We have not taken final action on the board for that one language change. So I guess to cut to the chase, in order for us from the equity standpoint to allow high school coaches to coach high school athletes out of season, say within the high school setting, it does require about 3 different subsections of the regulation, 1008 and 1009. And probably the biggest hindrance to this point has been when we're talking about doing this within the school setting, we give an awful lot of credence to our Sports Medicine Advisory Committee, who has been quite outspoken with trying to prevent overuse injuries and sports specialization, which we cannot stop if a student is participating as a private citizen or part of a club or a league. But great deference has been given to sports medicine and trying to work through not only the regulation changes for the coaching out of season, but also not going against the recommendation that's given to us from pediatricians, doctors, orthopedics, trainers, school nurses that serve on that committee. So that being said, I think it's possible we can get this done by the end of the year, but there's a lot to be worked through. Executive Director Polk did send out a tentative schedule for several more meetings than what we typically have. So with these meetings, if we take an aggressive stance and can bite off a little bit each time, then my hope is we may be able to wrap something up by the fall, as opposed to maybe the end of December.
I obviously do not serve on DIAA, but I have, we've all been working with you through this process. It seems that what you're talking about is more complicated than what folks are saying needs to be done. Could you provide the staff with a list of outstanding issues on this topic? And that may help them develop a recommendation that more specifically goes to addressing the outstanding issues, not just the overarching end game that is listed here currently.
Yes, I can work with folks on the Rules and Regs Committee and also our executive director and kind of hash out, the multifaceted side of this. I think what came out of Rules and Regs that was forwarded to the board about the coaches in their non-school capacity really addresses a lot of what was the impetus behind this. However, like I said, for equity's sake, for those students that may not have the means to pay to be in a private league or club, we also want to provide the same opportunity to our interscholastic athletes if they have that relationship with a high school coach to maybe get some informal instruction or sports specific instruction out of season. And we can work through that, yes.
Okay, and if you could provide that, sorry, to Mark and Amanda on our staff, that would be very helpful.
Certainly will.
All right, thank you. Representative Griffith was, oh, I'm sorry, Representative Yerrick, was there any follow-up there?
No, I appreciate Dr. Layfield making that statement and a commitment to try to move it up. That I appreciate that, and it's a great idea to bring some recommendations back, and perhaps the staff will give them more work to do that they can make the recommendations as well. Thank you.
I will say that is one of Mark and Amanda's strong suits, is giving us all a little bit more to think about. So thank you. Representative Griffith was next.
Thank you, Madam Chair, and thank you, Dr. Layfield. One of the issues that came up at our last meeting, I think it was last week, although my gosh, it feels like months ago in some ways, was the issue of the standing committees making decisions on tournament selection and seeding when that was really something that should be within the purview of the full board. Could Mark or Dr. Layfield, whoever is, where is, here it is that, can you spell out how that's addressed in these recommendations? I see you moved it, Mark. Maybe you could walk me through it, please.
Sure. This doesn't drill down as specifically as you just did, Representative. This is more along the lines of having DIAA and the board make changes to the current regulations to make the standing committee process and the representation on those committees more transparent. That can be a separate recommendation that I can work on drafting when it comes to specifically the tournament and setting the details for spring and fall winter tournaments.
Well, I don't want to micromanage, so to speak, what the regs are. I just think what the overall arching concern on that, I think, was that there was a regulation that was not being followed. So what's the redress there? I mean, I'm wondering if we might structure a recommendation that says, all right, so if this happens on one of the regulations where the regulation is not being followed, and regulations should be followed to a T, and often for whatever reason, we've been through a pandemic, so we see how some regulations are more difficult to follow than others. But what happens, and maybe we structure something for in terms of redress for when there's something that happens like that, how that's brought to the full board's attention or to the community's attention. Just a general, because if it's not that regulation, maybe it'll be some other regulation down the road, and I would hate to not encompass, I'd hate not to include other things that might happen. So thank you, Mark.
Sure, and Dr. Layfield might be able to talk about this, the structures currently in place for any sort of violation of the current regs as they are right now.
Yes, the part that I think obviously came up in the fall was the board basically tasking the different sports committees to come up with the criteria for one, entry into any of our fall tournaments, and then how seeding would work. The board was, I want to say the board was relatively clear, but not specific in with how to be clear, that we didn't want to necessarily hurt any team or individual student athlete for things out of their control, say due to COVID cancellations. And unfortunately, when the board tasks the sports committees, when we found out we were going to have fall sports, we told them, we want you to, show some flexibility and responsiveness to teams as they're trying to deal with the pandemic and potential quarantines or cancellations of games that couldn't be rescheduled. So the original plans that were sent to the board from several sports, volleyball, field hockey, football, and I believe soccer, all had minimum game schedules where, minimum games to be played in order for entry into the tournament. And that as the end of the season grew near, there were many teams in the eyes of several of those committees that, were, possibly the best teams to represent, their particular school or particular conference in the conferences. So what happened among some of these committees is that they changed their criteria for minimum games without that coming back before the board. I do believe that all of those committees were trying to act in the best interest of, student athletes and fairness, but sometimes when you try to be too open and fair, you lose consistency. So we learned from that before, and we remedied that here with our winter sports as we prepare for the tournaments here just a week or so away. And same thing when we're now seeing our preliminary plans for the spring, that those committees are to be very specific to us for their initial plans. And if for any reason they were going to deviate from something that was passed by the board, those committees would need to come back for the board for approval, or otherwise that they simply by our regulation do not have the autonomy to change it. Even though I think initially in the fall, in trying to address, fairness, we wanted to task them with coming up with with plans to do so. And we obviously saw where there were some failures there.
Thank you, Dr. Layfield. That's helpful. I'm wondering if my colleagues feel that it might be important then, in light of that, to add maybe as part of this recommendation, an education component that as part of the standing committee process, that those committees are also educated on their authority, you know, where it begins and essentially where it ends, so that you don't have this situation arising where one committee is doing one thing, another committee is doing another thing. And that, because that really cuts at the heart, and that's where we tend to see problems, intentionally or not intentionally, really, you know, and equity and fairness. You know, if group A is doing something, group B is doing something, even if it's out of the goodness of their hearts or whatever, if you're still getting different results, you know, that causes problems. And so I think enforcing and maybe, you know, putting an exclamation point on what these standing committees are allowed to do might help in that process. So maybe we add an education component to the standing committees, and it seems like it could be easily added to Part C there. Ensure all membership information and committee decisions are easily accessible on the DIAA website, but we might also add a section in there that says to make sure that these standing committees are educated exactly as to what their roles and responsibilities are. Thank you, and I have no further questions or positions at this point, Madam Chairman.
I agree. I think Representative Griffith, you've hit on something important. And recommendation 3, subsection E, talks about committee member staff training program. And so maybe part of it too is making sure that subsection E specifically, you know, whether it's, you know, whether we take some of what Representative Griffith has said today and maybe make that a little bit more explanatory. But we can take a look at that, potentially 2 areas. Madam Vice Chair is next.
Thank you, Madam Chair. Regarding into the DIAA Director and President, thank you so much for joining us. I'm glad that we were able to, well, your entity was able to get the situation regarding Howard High School situated, and there was a level of equity that was exhibited with that. Couple things regarding SCR 79, and I believe Mr. Brainerd is taking us there. Senator Poore spoke about that piece of legislation being passed. And Dr. Layfield, if I heard you correctly, you were saying that there's still some issues with implementation of that. What seems to be the issue, and how can we help you move that forward? Because that was 2 General Assemblies ago, which would mean that was almost 4 years ago, and it still hasn't been implemented. So what else do you need from this body and the larger community, so that we can in fact start moving toward coaches being able to coach their athletes in the off season?
As I said before, I think the biggest hurdle in doing that within the school setting right now is doing so safely under the advice of our Sports Medicine Advisory Committee. Obviously, whenever it comes to anything health and safety wise, I, as one board member, and I think I can speak for much of the board, that it's usually a big hurdle for us to go against the advice of our Sports Medicine Advisory Committee, who obviously, you know, directs us for things, you know, in dealing with student safety. A big portion, as I said before, the impetus behind the Senate Concurrent Resolution 79 really dealt with what high school coaches were doing as private citizens, providing, you know, sports-based instruction in private leagues and clubs and things of that nature. And we were able to take some action out of rules and regs that are now been recommended to the board. But I think for us, I don't know that it necessarily requires anything legislatively to change the statute, but what it's going to take is several folks on our Rules and Regs Committee to look at all of the impacts throughout our overarching regulation 1009 that governs high school sports, that there are at least 3 subsections that I'm aware of, 5.0, 6.0, and 7.0, that require almost the entire section to be rewritten of regulation as it pertains to what is permitted for coaches to do out of season. So the work really needs to be done by our Rules and Regs Committee and then to our board, rather than, I think, moving things forward from a change in statute per se.
So Actually, my math is a little off, was a little off on that. So that may have been about 5 or 6 years ago when SCR 79 was passed. And I'm wondering how long should the community have to wait for something once it's passed legislatively for it to be implemented with the DIAA? As I listen to your explanation, Dr. Layfield.
My hope is that it would have been completed last year by the time the COVID pandemic had hit. We had two stumbling blocks in the beginning. First was a PIC opinion from several years ago about whether it was even something that was in our purview to do without a legislative change. As things evolved, basically, to my knowledge, that PIC opinion necessarily wasn't germane to this particular thing moving forward. But once we surveyed our membership and said that we're going to allow students to receive, instruction from their coaches, as private citizens and not based on the school, not based within the school, then we also need to look at the several regulation changes within our regs to allow high school coaches to do that within the high school, as I said before, for those that may not be able to afford to be on a club team. And it was at that point in time getting the information from several stakeholders, primarily, once again, our healthcare professionals, that have cautioned us to be very, very careful and deliberate moving through it, to the point where obviously, this was passed and surveys went out in 2018, and then throughout 2019 and in the beginning of 2020, progress was very, very slow. I think it was too slow. And I believe that our executive director and our rules and regs chair, Dr. Matt Donovan, have put a very ambitious tentative meeting schedule that was just sent out to those members today, where instead of rules and regs meeting 4 times a year, that in order to get this done and several other things, but this would be priority number 1 through rules and regs, where there are, I believe, at least 6 to 7 meetings between now and July. So it obviously is a priority of Executive Director Polk, along with Dr. Donovan, that they want to tackle this, get it behind us, and open up those opportunities for our coaches and our student athletes.
Thank you, Dr. Layfield. And my final question, in our last meeting, you mentioned about insurance. I think it was either you or Director Polk mentioned about the insurance policy. And I don't want to misquote you, but the question that I have regarding the insurance policy, does it still exist? Because it was brought to Senator Gay's attention as well as mine that I believe the policy was $73,000 annually, and it was costing DIAA $1.2 million. So does the policy still exist? And if it doesn't, what do we need to do to ensure that our student athletes are in fact protected if something happens to them?
I'll lean on Executive Director Polk for this. I know she knows those details about the inner workings of that a little bit better than I do.
Thank you, Dr. Layfield.
Thank you, Representative Dorsey. With the insurance right now, we do not have the statutory authority to purchase insurance. I think that is the biggest concern as it relates to even trying to get insurance and then being able to purchase it on behalf of our member schools. It's also possibly a concern there as well. Currently, the policy was not, you mentioned $1 million?
No, $73,000 annually. Yes. And to my understanding, it was that DIAA spent 1.2 million. This predates you. So these are numbers prior to you taking over. But 1.2 million was spent in insurance policies. Are you aware of that, Director Polk? And like I said, this predates you, but I wasn't sure if that information had been shared with you.
The information, are you talking about the catastrophic insurance?
Yes, ma'am.
We have 2 insurances. It was the catastrophic and it was also the rental insurance, and that's roughly 25, and the insurance was roughly around 50 annually.
So you're unaware of the 20 years of the 1.2 million that had been spent?
I am aware that that insurance was provided previously. I don't know over the years the total, if it was, I guess I can calculate over the last 20 years at 50,000. It would be
roughly.
Yeah.
Mhm.
Over the last, 20 years, it would have been that. Yes.
Yes.
Mhm.
Does that policy still exist, Director Polk?
No, ma'am.
Okay. And what has replaced it?
Um, Nothing has replaced that insurance.
So I just want to make sure that, so each one of our student athletes, their parents need to be insured in order for them to play? Or how does that work if one of our children gets hurt during a game?
And Dr. Layfield, I don't know from a school standpoint, if you can chime in from a principal standpoint, how you manage that.
The best of my knowledge, students would be covered under the insurance policies of their member schools. Similar to if a student gets injured in a physical education class and the parents are not insured, there's a standard form, at least in the Indian River School District. I would assume it's pretty much the same in any of our public school districts and private schools for that matter.
Thank you, Dr. Layfield. Thank you, Director Polk. Appreciate you.
Thank you, Representative Dorsey Walker. And just to follow up on Representative's question, were there claims made on those insurance policies over the course of their lifetime?
There has been one claim that I'm aware of over the last 5 or so years. There's been only one claim that I'm aware of.
And had the catastrophic insurance previously been a feature of membership for member schools for DIAA?
Yes, ma'am, it has been.
And so was the insurance change, was that communicated through to the member schools at that time?
It was even, yes, this past year communicated with the member schools.
Okay, I'm sorry, I'm having a little trouble hearing you, but I think I heard you say it was communicated through.
Yes.
And did you have member schools asking for that catastrophic insurance to be part of their membership again?
Dr. Layfield, I don't know if you've had that request. We haven't had that official request come in. I know that there were concerns regarding the change, but I'm not aware of any official requests from any member schools.
Yeah, I'm unaware that there was ever an official request. I know that since it was a benefit of membership prior to this change this past year, that a lot of folks were scratching their heads as to why. Once it was explained, I think mostly it came from the school chiefs, the superintendents that, let's just say, deal with that more of a global scale within the school community, more so than me as the principal and the building head, that there was a concern about something that had been provided before and the reasoning as to why it could not continue. And I don't want to misspeak. I know Mr. Rodriguez is on here. I think it came from DOE's legal counsel as to why.
Was there an adjustment then in the cost of membership for member schools? Adjustment down?
No.
The fee structures are still the same.
Okay. And did you receive any, I'm just curious, you received any complaints about that change?
Not that I'm aware of. I'm not sure if Director Polk did in her office.
No.
And so if we were to make changes, I understand the legal argument is that there isn't an ability to hold these policies. And in that way, that's a good audit system, right? Understanding what the strength, what the scope is, and what the allowable scope is. My question is that if that changes, does DIAA intend to go back to the catastrophic insurance policy, or is this being covered at another level, like the school level or the district level?
Currently, right now, it would be at the school or district level, considering we don't have the authority to do that. If the authority was granted, that would be a conversation that the board would have to have in regards to obtaining that insurance again.
And I think I talked about this with you all last time, but just refresh my memory, the rental insurance you need to have, though. It sounds like the catastrophic insurance is something that maybe is being duplicated at a different level, but the rental insurance you need, and so you need us to make that change. Is that correct?
Yes, ma'am.
Okay, and Mark, can you just point me to where that is? Because I swear I read it, but now I'm...
No, I'm sorry, that is not included in these. I can probably add that into recommendation 9 when we are amending chapter 3, title 14, to allow the ability to pursue scholarship opportunities and other non-tournament related revenue streams, kind of adding another sentence in there as to the ability to purchase necessary insurance. Holly, don't yell at me for my lack of legalese, but something along those lines.
Out of all the attorneys I've met, Holly is one who will give you grace. So thank you for including that. And I want to get to Senator Pinckney's question. I just wanted to ask if anyone, any of the committee members have any thoughts or comments regarding that potential add, any objections? Oh, Mr. Rodriguez would like to speak.
Thank you, Senator. I think one of the concerns with that is, as a state agency, we would be taking on liability if we purchased that catastrophic insurance. So that would be, I think that's the sticking point at this point. We as a state agency have sovereign immunity. If we take on that insurance, we would be taking on that liability also.
It's the assurance on behalf of the member organization. I mean, and don't get me wrong, I'm again, like Representative Griffith said earlier, we're not trying to micromanage these regulations, but we're trying to give this organization the tools it needs to move forward productively and to execute its mission. So, you know, when it sounds like catastrophic insurance may be being handled at another level, but I'm concerned, it sounds like you need rental insurance capabilities. Am I correct there?
Yes, for our state tournaments.
Excellent. Okay.
Senator Gay, I don't mean to jump in. I'm just curious. Maybe I'm wrong. We have other attorneys on this call. I know Senator Hansen, but I don't necessarily think by having insurance, you open yourself up to liability. I don't know that the two are interchanged. That's just back to my contract insurance law school days. But anyway, I think we need some more information on that one. Thank you.
And as informal counsel to Representative Griffith, I'll state she's not providing a legal opinion at this time, but I appreciate that insight. I will leave this issue be. Thank you for everyone's time. And Senator Pinckney, please take it away.
Thank you, Madam Chair. I am going to be frank in my messaging. And going back to the same issues that have already been raised by Representative Dorsey Walker and her beautiful oral skills, I am quite frankly underwhelmed by the responses to Senate concurrent resolution that was introduced in the 149th General Assembly. I don't know of any other organization that is under review that I've received so many complaints against. I was just reviewing the public comment again, and I read things like public comment during the board meetings have been moved to the end of the meeting, where often we find that board members are getting up in the middle of public comment and leaving because the meetings have occurred. There were complaints about a lot of complaints, friends. There were a lot of complaints that have me not impressed with the responses that have been given to us for how these concerns are going to be addressed. So I'd like to go back to the response that Dr. Layfield gave in response to Representative Dorsey Walker's question about the 5 years that it's taken to get Senate concurrent resolution addressed. Dr. Layfield, you said that one of the problems is going to be hearing from or getting a response from the Sports Medical Advisory Committee. Can you give us more specifics around what you need from them and who we need to reach out to? Because if you're telling me that this body, or not even this body, it actually came from another senator, and if you're telling me that a senator of our state can draft legislation requiring something to occur, and it's taken 5 years for it to occur, I am quite frankly not convinced that we need to that there is a chance or that anyone is deserving of waiting until the end of the year to meet requirements that were presented to you all 5 years ago. I think there was a recommendation to decrease the time that will be allotted to make these changes happen. And I understand your concerns about reducing the time, but if you've had 5 years, I am not convinced that we need to give another year to make these changes happen. So I'd like you to give us even more in-depth information on what it is that you need accomplished or need from the sports medical advisory. And I'd also like you all to address how you intend to address community concerns, specifically around community voices being heard. Like I said, there were concerns that board members get up and leave the board meetings in the middle of public comment that take hours to get to. There were concerns that there are no voices of parents on the board. I guess overall what I am asking is to further convince me that termination is not the correct way to go, because I'm very underwhelmed.
As I stated before, the action on changing the regulations for coaching out of season has been way too long and belabored. And as the board chair, I would like to see action on this much sooner than the end of the year myself, as what is currently in the recommendation. I don't know that there's anything that we necessarily need as far as the recommendations from our sports medicine advisory committee. I think what's going to take is for us to look at what potential regulation changes we have and see what they can do to support it. Because right now they're pretty much unanimous from the sports medicine field that they do not want us moving in a direction to allow coaching out of season. However, as the board chair and obviously the folks that work for DOE, we've got legislation from the General Assembly level that say we want to see coaching out of season opened up, and there ought to be a way to do it safely. I think if there's one thing we've learned from this pandemic is that a lot of folks didn't think sports could happen safely at all, and so far we've been able to manage that. So I share your frustration in that if we've made this work, we ought to be able to get some heads together and change the regulations that we have in order to move forward with opening up coaching out of season to a greater extent than what it has been.
Go ahead.
I know Mr. Rodriguez had his hand raised, but I just wanted to see if Senator Pinckney had any follow-up, or if it's okay to move to Mr. Rodriguez at this point.
That's fine, Madam Chair, and Executive Director Polk also had something to say, so I'd like to hear from them both.
Thank you for flagging that. I apologize. In this view, I'm unable to see anyone who's just waving at me. So whichever of you would like to speak first, I'll let you two decide how to handle the response.
Thank you, Senator. I just want to just elaborate a little bit on Dr. Layfield's abridged version of what took place. The DIAA board put forth a proposal and published the changes. During the public comment phase of approving that, there was great outcry from doctors, from ADs, from multiple stakeholders with concern about the safety of our students, which is that's one of our primary missions as an organization. And at that point, withdrew those proposed changes, and then, not to make excuses, but we had, 2 executive director changes, and then with the hit of COVID, kind of slowed it down. And I'm not so sure it's been 5 years. I've been here less than 4 years, and I know that occurred maybe a year into me being here, so I'm not exactly sure of the date, but just to put a more reasonable timeline on that. But I do want to just want to share that we did propose the changes. They were published, and based on public comment, we withdrew those changes based on the conversation that took place at the board meeting.
And Senator Pinckney, if I can also share that, Dr. Layfield has alluded to the regulations that potentially would need to be changed to make coaching out of season occur. We're not just dealing with allowing our coaches to be able to coach just their club teams, but it also impacts how coaching out of season would occur during the academic year, what that actually is going to look like, whether it's a team-oriented out of season coaching versus individual development. Our member schools, some are not in favor of that, and I think getting the feedback from our constituents is also important on how they are able to implement that. There are concerns in regards to facility use, overuse of our student athletes, not going over the permissible hours within a week. You know, it's going to force some of our student athletes to specialize in a sport when we are, you know, wanting to support a multi-sport athlete. So there are a lot of other issues, just getting into more of the details that we are, even at the Rules and Regulations Committee level, trying to make sure that we're being intentional on identifying what those impacts potentially will be from our member schools. Also looking at the rules, we changed one. There's, as Dr. Layfield stated, a whole nother section that we have to address to make sure that we're getting right, and that it's not going to create inequalities, and it will. Right now, with the current proposal that is in place, it's going to create inequalities for our public schools and our private schools, and how they're going to be able to manage that or not be able to manage that. Those are concern of mine with doing that and not completely looking at the entire regulation. So it is a challenge to kind of make sure that we're getting this right. And I just wanted to kind of share that as well. It's not that the concurrent resolution doesn't want to be met. It just has a lot of challenges within our stakeholders of their concerns and how they're needing to implement this safely and fairly across the board as well.
And just as far as the timeline goes, it was the summer of 2018, I believe, when the resolution was passed, and that we were then tasked with getting feedback from our stakeholder groups. That happened in December of 2018 into 2019. We worked throughout 2019 and got that proposed regulation change that Mr. Rodriguez mentioned out for public comment. That's when basically, you know, due to the public comment of getting the stakeholder groups by the spring to summer of 2019, we decided we needed to go back to the drawing board because it wasn't as simple as was first thought. Not like Mr. Rodriguez said, no excuses. At that point in time, when we were in the summer of 2019, I think we probably could have set a more ambitious meeting schedule with rules and regulations as we finished out 2019 to go into 2020. It was at that time there was, you know, staff turnover with executive directors. But, you know, in retrospect, obviously, had we taken the same aggressive meeting schedule that Executive Director Polk has now put in place between now and July, maybe back in June of 2019, we may be able to have wrapped this up prior to COVID hitting. And I'll be the first to say, ever since March, when we've been trying to deal with COVID, that has been the primary focus of just about all of our meetings, not only rules and regs, but several others. So all that being said, and in retrospect, hindsight being 2020, I do believe that the progress that we have the ability to make between now and the end of the year, and hopefully between now and the fall, should be enough to tackle this problem and get it behind us and be able to move on.
Thank you. I do hope to see these things occur this time around. And I think not only from this body, but from a community standpoint, there's going to be a lot of scrutiny making sure that that happens. So I am holding you all to your word. Thank you.
Thank you, Senator Pinckney, and thank you all for your comments in that area. I mean, I have to amplify what Representative Dorsey Walker and Senator Pinckney have said. I've heard similar concerns about the progress made here. I appreciate that the three of you acknowledge that that's a valid complaint and that we can do better and that you're focused on it. But in light of this issue being particularly, I think, urgent as a means of community engagement and public trust, I think that perhaps some additional follow-up reporting on this piece in particular may be warranted to help us work with you to meet the community expectations. And so, Mark, I'd like you to consider in recommendation 12, perhaps adding some information about specific status reports on out of season coaching, or perhaps in recommendation 10, however it sees fit when we get the next draft recommendations here. I think that would help help Representative or help Senator Pinckney as well as others understand and have some feedback so that these issues can be addressed. And I think Senator Hansen was the next one who was on the list.
Thank you, Madam Chair. I wanted to pick up on one of the things that Senator Pinckney brought up as well, and that is the issue of public comment and when that happens at the meetings, because that again that's something that we typically end up discussing at Sunset Committee hearings. I remember this was the issue at a previous organization that we spent some time talking about, because again, it was the problem where public comment wasn't until the very end of the meeting, and the meetings ran long, and people felt that they didn't have a voice, and that again, the public comment was happening in some cases after the vote on the things had happened, which doesn't seem to make any
DOE,
sense.
Senator. The DOE.
That was, yes, that was it. So I just want to mention that here, because I think that we've talked about, like in B, let's see, recommendation 6, section B, establish a standing public comment period that occurs prior to a scheduled executive session. I would add a public comment period that occurs prior to a scheduled vote, because if you're not having public comment until after a vote, why are you having public comment?
If I was going to say, is if that's a question to me, when I first came on the board, and I believe even when I was beginning as board chair, public comment was similar to the way we do things in the Indian River School District. There was a 15 minutes set aside in the beginning of the meeting, kind of before any action items were taken after the approval of the agenda, and 15 minutes at the end. My understanding, and I could be wrong, this is going back at least 4 to 5 years, our legal counsel advised that with public meetings that, public comment just was, it had to be in there. So rather than having 2 sections in the beginning and the end, because meetings were getting very, very lengthy, particularly with waivers, we went down to just 1 public comment period. I know that it was never asked of me as the board chair. I can't speak for Mr. Neubauer or Mr. Samaglia, who's after him, as to whether the executive director was actually consulted saying, we want to cut it back to just 1, and do we keep the beginning one, or do we keep the one in the end? But from my best recollection in getting advice from our legal counsel was that we're only required to have 1 section for public comment. And at that point in time, we cut out the 2 sections where it was the beginning and the end. I in particular have no problem with having that public comment in the beginning, and it makes sense what you're saying, that if folks see what's on the agenda and would like to publicly comment, the board can consider and hear those prior to taking any votes on any regulation change or anything for that matter.
That would certainly make sense, if you're only required to have 1 public comment period, then certainly having it at the beginning prior to any vote taking makes sense, as opposed to in the end.
Yeah, I would have no problem with that. It makes sense to me as well.
Thank you, Senator Hansen. And I believe Senator Pettyjohn's hand went up and down, but he was after Senator Hansen.
Thank you, Madam Chair. I just want to clarify for the record and anybody that's listening in, the Senate concurrent resolution, it was passed the House on June 28th of 2018, which according to the little tool that I have was 2 years, 7 months, and 19 days, well shy of 5 years. But still, I just want to make sure that it's clear for the record what the length of time has been since that was passed by the General Assembly.
Thank you so much, Senator, for the clarification. As a litigator, I appreciate a clean record for a case, so thank you very much. Senator Hansen, did you have a follow-up question? I wanted to note your hand was still raised, but I didn't want to. I'll lower it for you. No worries. Thank you. Representative Dorsey Walker was up next.
Thank you, Madam Chair. That's exactly. Thank you, Senator Pettyjohn. I did the same exact thing, went back and looked to see when this was actually passed, and to see that two of our committee members, Senator Hansen as well as Representative Yurick, are co-sponsors on Senate Concurrent Resolution 79. It is even more important that we get this implemented, but I would like to say a thank you to Dr. Layfield as well as to Director Polk, because it's important that we work together and not try to create excuses, but to see that there's a situation and let's try to work toward getting it resolved. And again, this predates you, Director Polk. So Dr. Layfield did share with us your ambitious timeline. So we're counting on you to get this done, Director Polk. So thank you very much. And again, thank you, Senator Pettyjohn.
Thank you, Representative. I'm seeing no other hands at the moment, but I wanted to give everyone a moment to get any last comments or questions in. All right, Mark, I know that you're taking lead on this review. Do you have any outstanding questions or concerns related to the comments that were made?
I don't believe so. I took pretty extensive notes, so thank you all for the feedback. I will, at the very least, I'm going to retailer these, maybe give a couple options, path forward in the areas where there was still some discussion about final direction. So I will take most of these back and retool them for you so we can move to possibly adopt some of them next month in March.
All right, excellent. Okay, well, with that, that concludes our agenda for the meeting today. Thank you, everyone, for your time and attention. Thank you, everyone from DIAA for joining us again. We appreciate your engagement in this process, and the answers that you provided are going to help us make the recommendations that much better and more accessible to you as well. So what I guess we'll say to the committee members here is that you should be on the lookout for scheduling emails coming through. So please take a look at that. We're going to come together again in early March. And if there are no other questions, the meeting is adjourned. Thank you.
Thank you, Madam Chair.
Not supposed to go anywhere.
Hold on for 30 seconds.